Hello, good morning all. This is Dr. Praveen, Medico ENT faculty. Happy to see you all again, my dear students. Today we will be seeing PYQ session in ENT. So the questions will be from the previous 5-year questions, and we know that repetitions are quite important to get more out of the repetitions, which will be commonly asked in exams. So with this session, let me try my best to give you points, the more important points regarding this ENT subject. And the questions will be randomly from ear, nose, throat. It will not be in the order as from anatomy to in a straight line, not in the linear fashion. As in the exams, we'll be seeing the questions in a random manner. So to start with, we'll start the questions. And if you have any doubt, don't hesitate and please comment in the comment box and let us discuss about your doubts. Okay, just start with the questions. So the first question will be the picture question. And we know these picture questions are quite common nowadays. We need to know the anatomy and all important pictures in ENT. Identify the structure marked in the image. Incus, stapes footplate, lateral semicircular canal, malleus. So if anybody knows about the answer, please give your answer in the comment box. What will be the structure? See, they have clearly marked this structure in the picture. What is that? Can anybody tell this? This is a ear anatomy question. And the answer should be any options, chances. So the answer is malleus, actually. This is the malleus. Answer is D, malleus. Let us see the questions and important points regarding this middle ear anatomy. See this. This actually, the tympanic membrane of the right ear is being peeled away or elevated to expose the malleus. This is the handle of malleus. And the superior part of this handle of malleus is exactly the lateral process of the malleus. Lateral process of malleus. That's what they have pointed out clearly. And the question is simply the malleus. So this is called the lateral process of the malleus. And this is called handle of malleus, and this is the tip of malleus, which is called as umbo. And see this in the posterior superior part of this picture, we can clearly see an ossicle there. And can you tell me what is that ossicle or assembly there in the posterior superior part of the mesotympanum? That is incrostapedial joint assembly. I will show you with color pictures also. With this picture, these are all the structures we can clearly see. And the answer for this question is malleus. We'll move on to the next slide where we can have with the first image here. See this. With the first image here, we can have an overall idea. Simply I tell you, see, this is pars tensa, and the smaller area here, this area is pars flaccida. Compare with this real anatomical picture, how it looks like. So the pars tensa covers the mesotympanum of the middle ear, and the pars flaccida covers the epitympanum of the middle ear. See, from the real anatomical picture, the bigger part of the pars tympanic membrane is pars tensa, and so this, the smaller area, a little area of the tympanic membrane is pars flaccida. And with this, we can also see how this malleus is closely adherent to the pars tensa. See, this is the handle of malleus. This is the handle of malleus. And the center point is called umbo. And we can very clearly see the cone of light in the antero-inferior part. And for your orientation, all these anatomical pictures are from the right ear. Hence, obviously it should be anterior, this is posterior, this is superior, and this is inferior. And see from this picture, the right ear tympanic membrane, the pars tensa is clearly seen, and the pars flaccida, a smaller area, pars flaccida. And other points to note is, see this point, exactly this point. This point is lateral process of malleus, and the important MCQ here is this lateral process of the malleus is the most prominent structure of tympanic membrane. The MCQ point, very important. The most prominent structure of the entire tympanic membrane is the lateral process of the malleus, because it is very persistent. Even in extensive disease, this process will exist, will be destroyed only at the end. So with this process, we can identify the structure below will be your pars tensa, and the structure above will be your pars flaccida. So lateral process of malleus, below is the mesotympanum, above is your epitympanum. So this is one important MCQ regarding this lateral process of the malleus. And again, in this tympanic membrane, the pars tensa is surrounded by a fibrocartilaginous ring, fibrous ring, that is called annulus. And this annulus will be deficit in pars flaccida, which is covered by the bare bone. It is not annulus, it is a bare bone. So that is called notch of Rivinus. That is called notch of Rivinus. Okay. At the end of this area, what is this bone? Above the pars flaccida, which also covers the epitympanum, the lateral wall of the epitympanum. The bone above the pars flaccida, which forms the lateral wall of the epitympanum, lateral wall of the attic. And that bone is called scutum. So please remember these points. Scutum, which forms the lateral wall of the epitympanum. So hence, pars flaccida and scutum both forms the lateral wall of the epitympanum, and the pars tensa forms the lateral wall of the mesotympanum. Okay. Let us come to other areas of the question, how the other ossicles looks like. And I will show you some other images. So with this first a schematic, a pencil diagram image, where you can see again, see this. This mesotympanum is covered by the pars tensa, and you can clearly see this head of the malleus, the body of the incus are all present within the epitympanum. They will be asking you a question, MCQ again. The next MCQ point is, what are the components of the epitympanum and what are the components of the mesotympanum? So the epitympanum is the wider part of the middle ear, and mesotympanum is the narrow part of the middle ear. The narrowest part of the middle ear, the width of mesotympanum is only 2 millimeter, and the width of epitympanum will be 6 millimeter. So the wider part harbors the bigger part of the ossicles. This is one MCQ. Hence, what are all the components of the epitympanum? The bigger part of the ossicles. Head of malleus with its neck and body of incus with its short process. So the head, neck of the malleus and the body with the short process of the incus forms the part of the epitympanum. and the slender parts will be seen through the mesotympanum. As in the picture again, watch this. So here we have in the mesotympanum handle of malleus, long process of incus, and the whole stapes, which sits in the oval window, which is a part in the mesotympanum. So the slender structures of the ossicles are present in the mesotympanum. Simply, the bigger parts in the wider part of the epitympanum, and the slender part of the ossicles in the narrow part in the mesotympanum. So this is how these ossicles are aligned in the middle ear. Then, again, if you watch the first picture, the external meatus, which the bony part is called tympanic bone. The bony part of the external meatus is called the tympanic bone, which opens into the tympanic membrane and the middle ear. It's not opening, it's carrying you, leading you to the tympanic membrane in the middle ear, mesotympanum. And if you correlate with the inner ear, how this inner ear is situated, the anterior part of the inner ear is cochlea, and the posterior part of the inner ear is semicircular canals, simply. Hence, if you open the middle ear, if you open the tympanic membrane, the bony bulge you will be seeing will be the cochlea, and the semicircular canals are oriented with your mastoid. So if you open the middle ear through the tympanic membrane, you will encounter the cochlea, and if you open the mastoid antrum through the mastoid, you will encounter the semicircular canals. So this is how this inner ear is related to the middle ear for your orientation. Let's go with the other pictures. See this. After peeling the tympanic membrane with the annulus, pars tensa with its annulus is peeled away, very clearly seen the handle of the malleus with the lateral process and the umbo. This is the lateral process. And in the postero superiorly, we can very clearly see the incudostapedial joint assembly. And this, the peeled away pars flaccida, and this is the scutum. And this is a very zoomed in picture of the posterior superior part of the mesotympanum. Again, the handle of malleus, lateral process of the malleus, incus, this is incus, and this is the stapes, the whole stapes sitting over the oval window. And what is this linear structure? What is this linear structure here? Passing in between the long process of the incus and the malleus. That is chorda tympani. Chorda tympani, branch of the facial nerve. See, we know the facial nerve runs vertically in the middle ear, in the posterior wall. Again, please orient yourself. We are seeing the right ear. This is anterior, this is posterior, superior, and inferior. So, in the posterior wall of the middle ear, the facial nerve runs vertically. And from the facial nerve, we have the chorda tympani arising from the vertical part of the facial nerve. And this chorda tympani passes across the middle ear from the posterior wall. It passes in between the incus and malleus, the long process of the incus and the handle of malleus, and exit out of the middle ear through the anterior wall. So this is a course of the chorda tympani. That's what we are seeing here in this picture, in the second picture, the chorda tympani in between this handle of malleus and the long process of the incus. So this is about the closer view of these pictures. A little closer in this picture, come to this picture again, the right ear, imagine right anterior, and this is the posterior. Here the malleus and incus are removed. Now you are clearly seeing the medial wall of the middle ear, and of course the anterior wall of the middle ear and the posterior wall of the middle ear. So this is anterior, this is posterior, and what we are seeing is middle ear. This is middle ear. So in the medial wall of the middle ear, what are all the structures, important structures we need to know anatomically and MCQ wise? As I told you, if you open the mesotympanum, the medial wall is formed by the bony bulge formed by the cochlea. So obviously the bony bulge, what you are seeing in the medial wall of the middle ear in the middle is formed by the basal turn of the cochlea, that is called promontory. Basal turn of the cochlea, that is formed by the basal turn of the cochlea. And three important structures you need to remember around this promontory in the medial wall of the middle ear. So first structure, a bony projection in the antero-superiorly, and second and third are the windows, postero-superiorly and postero-inferiorly. So what is this bony projection in the antero-superior part of the medial wall of the middle ear? That is very, very important MCQ area, that is called processus cochleariformis. You can very clearly see this bony structure, that is called processus cochleariformis. So what is this processus cochleariformis? A bony projection where the tensor tympani muscle from the anterior wall attaches to this processus cochleariformis and hooks around to get attached to the malleus, the neck of the malleus. So that is the anatomical reason why this process cochleariformis is present. And the points regarding this cochleariformis is, again, this is the most prominent structure in the entire middle ear. Like we have seen the tympanic membrane MCQ point, the most prominent structure of the tympanic membrane is the lateral process of the malleus. The most prominent structure in the entire middle ear is processus cochleariformis. That's quite important. And the second point to note about this process cochleariformis is, again, this forms a very important landmark for first genu of facial nerve. This forms the important landmark for the first genu of the facial nerve. See, we have plenty of landmarks for the second genu of the facial nerve. We will see that. So the important landmark for the first genu of the facial nerve is the processus cochleariformis. That's quite important to note. So, okay, where is the facial nerve in this picture, sir? Let us come to the point. Yes, going to the line diagram. The first diagram, again, see the yellow line here. The facial nerve is traveling from the inner ear. It takes a sharp first curvature, that is called a first genu in the middle ear. From the inner ear, it enters into the middle ear, takes a first genu in the middle ear. From there, it courses from the anterior towards posterior. It courses horizontally in the medial wall of the middle ear and takes a second genu there and courses vertically downwards in the posterior wall of the middle ear. And at stylomastoid foramen, it exits out of the temporal bone. So this is the course of the facial nerve in the middle ear. The first genu anteriorly, please remember, and then the horizontal segment, which is otherwise called as tympanic segment of the fallopian canal. The fallopian canal is the bony canal of the facial nerve, horizontal segment. And the second genu posteriorly, and from there it descends as vertical segment in the posterior wall of the middle ear. So the horizontal segment in the medial wall and the vertical segment in the posterior wall. And obviously, this horizontal segment is called as tympanic segment, and this vertical segment is called as mastoid segment, because we very well know the mastoid is related posteriorly to the middle ear. So the vertical segment is called mastoid segment. Sure. Now coming to the real anatomical picture, how this facial nerve looks like in the real anatomical picture of the middle ear. See this. This pink line, a light pinkish line, this is a horizontal segment of the facial nerve. This is how it looks like. And this is the labyrinthine segment well within the bony part of the labyrinth, which is not seen, of course. and this is the area. It takes a sharp curvature and runs horizontally. That is the first genu. So obviously, the first genu landmark will be your processus cochleariformis. That's very important. And then here it takes a second genu, this area, second genu. And from the second genu, it descends down as the vertical part of the facial nerve in the posterior wall of the middle ear. So this is the course, how the facial nerve courses in the medial wall of the middle ear and the posterior wall of the middle ear. Okay. So now the points regarding the posterior segment of the mesotympanum. I told you two windows very clearly. The one is superiorly oval window where the stapes is situated, and inferiorly this is the round window. So these are the two windows, postero superiorly and postero inferiorly. Check. Any points regarding the oval window? Yes, the oval window is sitting partly over saccule of inner ear. See, the oval window, from here the sound will be transmitted into the cochlea. This oval window is partly sitting over the saccule part of the vestibular apparatus. So any loud sound will also stimulate the saccule of the inner ear. So the oval window is partly sitting over the saccule of the inner ear, and round window is closed with a membrane called secondary tympanic membrane. So sometimes the question will be very simply, the round window is closed with tympanic membrane. So don't blink, tympanic membrane is not closing the round window. So it is actually called as secondary tympanic membrane, a small membrane which closes a round window. So that is called as secondary tympanic membrane. They will tell that. So this is about this orientation of the medial wall of the middle ear, and little points about the anterior wall and the posterior wall. Again, with the same picture, quite easy to understand. Simply, in the anterior wall, we have the opening, the predominant opening called the opening of the eustachian tube, and the canal for the tensor tympani muscle, and the third small opening for the chorda tympani to exit. We have seen the chorda tympani course, and this chorda tympani exits through the anterior wall out of the middle ear. That is called canal of Hoogier. Canal of Hoogier. So that is the three structures in the anterior wall, and comes to the posterior wall of the middle ear. Posterior wall of the middle ear, it is quite important to note again, because the very important MCQ lies here in the posterior wall. See, very simply, we have this middle ear and it connects with the mastoid antrum air cells in the posterior part. And what is the connecting pathway through which the middle ear gets connected with the mastoid antrum? That is called aditus. So simply, this middle ear, the same picture, this part is the aditus. There will be an aditus canal connecting the epitympanum and the mastoid antrum is the superior part in the posterior wall of the middle ear. And the second important structure in the posterior wall is the pyramidal projection. See this pyramidal projection. This pyramidal projection is a very important structure, pyramidal process, that is called pyramidal process. Yes, which gives attachment to the stapedius muscle and the stapedius tendon. This is the stapedius tendon. You can very clearly see that. Stapedius tendon and pyramidal process. And from that pyramidal process, the vertical part of the facial nerve actually descends. So that forms another part of the posterior wall of the middle ear. So these three structures, again, aditus, pyramidal process, and the vertical part of the facial nerve. So these are the three important structures in the posterior wall. And I always tell the students, this vertical part of the facial nerve is like mountain ridge passing in the posterior wall of the middle ear. And obviously, if there is a mountain, on either side of the mountain, two valleys will be present. Definitely, two valleys will be present. So these are the two foci on either side of the facial nerve in the posterior wall of the middle ear. So one foci lateral to the facial nerve and one foci medial to the facial nerve. The valley, the fossa lateral to the facial nerve is called facial recess, and the valley medial, that is deeper. See this again in the picture I will show you. See, lateral is nothing but the tympanic membrane and medial is towards the medial wall, inner ear. So this foci somewhere here, see this, somewhere here, hiding into the middle ear is called medial fossa, and that is medial to the vertical part of the facial nerve, medial to the vertical part of the facial nerve, and that is called sinus tympani. That is called sinus tympani. So these two recesses very, very important in the posterior wall. One lateral to the facial nerve and one medial to the facial nerve. So anatomically, coming to this picture we are seeing from the mastoid side. The patient is lying down on the couch. You are seeing the external meatus here. Please remember again, the patient is lying down on the couch, the right ear. So this is anterior, this is posterior, this is superior, this is inferior, this is inferior. So this is the position of the patient. So from the mastoid has been drilled out, cortical mastoidectomy is done for the patient, and here, see, you can very clearly see, this is the opening, the natural opening aditus. The epitympanum connects with the antrum. So through the aditus, what we will be seeing, I told you this is the epitympanum connecting with the antrum. So obviously the bigger part of the ossicles will be seen through the aditus. See, the incus and the malleus are seen through the aditus, obviously. And this is the posterior wall. In the posterior wall, you can very clearly see a structure running vertically downwards. It is the vertical part of the facial nerve. Vertical part of the facial nerve. And we know this facial nerve is giving a branch from the vertical part of the facial nerve. This is the branch chorda tympani. This is the branch chorda tympani. So if you iatrogenically open the space between the facial nerve and the chorda tympani, or simply lateral to the facial nerve, lateral to the facial nerve, this opening is called facial recess. So that is the facial recess. So the facial recess anatomy is medially by the vertical part of the facial nerve and laterally by the chorda tympani nerve, and superiorly, I will show you, is the fossa incudis. What is fossa incudis? The fossa incudis is nothing but the point where the short process of the incus is lying. This bone is the fossa incudis. The short process of the incus is lying in the posterior wall of the middle ear. That is called fossa incudis. That forms the superior boundary of this facial recess. So the importance of the facial recess is, if you want to do middle ear surgery, if you want to approach the posterior part of the mesotympanum from the mastoid, you can open this facial recess in the bone in the during surgery, and you can very well operate in the posterior part of the mesotympanum. And this approach is called facial recess approach, or since we are opening the tympanum middle ear from the posterior side, it is called as posterior tympanotomy. Posterior tympanotomy. This approach is called posterior tympanotomy approach. And this posterior tympanotomy approach is very well utilized nowadays in important surgery for the deaf children, and that is cochlear implant. So we are using this facial recess approach in cochlear implant surgery to place the electrodes inside the round window. See, I have again told you we are opening the posterior part of the mesotympanum. What are the two important structures in the posterior part of the mesotympanum? Oval window with its incudostapedial joint assembly and the round window. So we can expose these two structures very clearly, and we can place the electrode in the posterior through the posterior wall of the middle ear into the round window. So this is about the facial recess. Please remember, the facial recess is quite important in patienting. And this is the picture, how it looks like. Again, have a look. Because again, I'm telling you, the picture questions are quite important in ear anatomy, where if you understand the anatomy clearly, we can have some good marks in ear anatomy. So this is about this ear anatomy question. So these are all some important points regarding, and one more point. See, here we have seen an option in the question, lateral semicircular canal. So where is the lateral semicircular canal? I told you again in the initial part, the mastoid is related to the semicircular canals. We have these three semicircular canals, lateral canal, superior canal, and the posterior canal. So if you drill the mastoid very well, if you skeletonize the mastoid, you can clearly see a bony bulge in the medial wall of the mastoid, and that bony bulge is nothing but the dome of the lateral semicircular canal. It is how it looks like very clearly in this picture, in the anatomical picture, the bony bulge of the lateral semicircular canal. Again, with this picture, we can very clearly say the landmarks of the second genu of the facial nerve. What are the landmarks of the second genu of the facial nerve? Now, coming to the point, see, I told you this is the second genu of the facial nerve. So obviously, the second genu of the facial nerve is related to three important structures. Oval window. The oval window is lying antero-inferior to the second genu. With this, we can clearly say that the dome of the lateral semicircular canal. The dome of the lateral semicircular canal is postero-superior to the second genu. The dome of the lateral canal is postero-superior to the second genu. And fossa incutis, see this, fossa incutis. So fossa incutis is also at the level of second genu. If you remember, this is enough. At the level of second genu, the fossa incutis means the second genu is little medial to the fossa incutis. See, with this picture, we can very clearly see all this orientation. The second genu is little medial to the fossa incutis. So these are all important landmarks of the second genu of the facial nerve. And another important landmark come to this picture, the first picture. The first picture, please look above, pyramidal process. Again, the pyramidal process is at the level of second genu of the facial nerve. So these are all the landmarks. Many landmarks are there for the second genu of the facial nerve. And I tell you one important MCQ for the second genu of the facial nerve. The most common site of iatrogenic facial nerve injury is second genu. The most common site of iatrogenic injury to the facial nerve is second genu of the facial nerve. So we need a good landmarks, and we have plenty of landmarks for the second genu. Oval window, dome of lateral semicircular canal, fossa incutis, and the pyramidal process. So these are all the landmarks for the second genu. And remember one thing, for the first genu, the only very important landmark is the processus cochleariformis, which forms the first genu landmark. That is, the geniculate ganglion is present in the first genu. So this is where the geniculate, the first picture, please concentrate. The geniculate ganglion will be present in the first genu, first curvature of the facial nerve, and this process cochleariformis forms the landmark for that first genu.